Joined today by Curlin Blaze, a major contractor in this city, and Iceware Vezo, a rap star with Motown Records. And we're going to talk about a couple of things today. The first piece is the saddest piece. We have 20 more deaths that we're reporting for a total of 1,008 members of our community that we have lost in a little over 6 weeks. It's a total that's unimaginable. And we have 21 more reported cases today, but as we've seen over and over, most of those occurred earlier in the month. In fact, it looks like between about 3 weeks, starting in late March, we lost more than 700 of our citizens. And it's just all the more important that we continue to do what we're doing because the trend is continuing to be down dramatically. There's more empty beds in hospitals today. There's only 14 people over at the TCF Center. And the problems continue with our elderly. We now have lost 216 nursing home residents and 3 staff. And we have to keep doing what we're doing. It's unimaginable where we would be if we had not dropped the infection rates. Really starting on April 18th, we've gone steadily down. If we hadn't done that, it would be much worse. But even today, we're pretty comparable to New York in the number of our residents that we have lost. And so as we move on to the question of how do we restart the economy, we have been talking to contractors and about what we can do to get started. We have contracts outstanding for road work, for water and sewer work, for construction, for landscaping, and we have not wanted to start them until we knew for sure that we had the right protocols in place. And so we have 16 contractors who had been awarded $110 million worth of work, probably 400 to 500 people ready to go. They were awarded before the coronavirus schedule. Is it possible for me just to get the microphone that's on the end? Can I use the one that's on the end? Okay. Can I just use the microphone? Can you just hand me the microphone on the end? Will that not run down here? All right. Is this one working? All right, there we go. Minor technical difficulties. So here's what we had. We got 16 contractors. They had been awarded work to rebuild our roads, to rebuild the water and sewer system, to do significant construction projects around the city, $110 million in work, and they were just waiting for a notice to proceed. Then the coronavirus hit, and there was no way we were going to put 300 or 400 or 500 more workers into the streets and onto job sites until we knew we had this under control. And so again with Dr. Dunn, we have issued a set of standards for any construction project that the city enters into. And so you know the standards by now. You cannot come onto the job site and work unless you've been tested for COVID-19. And the city will provide free tests to every one of the workers on all these job sites. Whether we do it at the fairgrounds or we do it on the 15-minute test, we will test everybody who's there because we continue to know, and this is the most important thing, 10% of the people that you run into every day that don't have symptoms have COVID-19. 10% of people without symptoms are infectious. You have a job site, 20, 30, 40, 50 people, 10% of those on average will have the disease. And so it is really important that we test everybody. And then we're going to require every single day temperatures be taken and a symptom check be made as the workers come to the site, so that those who are running a temperature don't enter in with everybody else but get immediate medical treatment. We're going to have distancing. We're going to insist on masks. And so in the last 24 hours, we approached our 16 contractors. And we said to them, we know you bid this work 3-4 months ago, and you were awarded it based on those circumstances. There's going to be some delays in getting the testing done, although we're going to move pretty fast. It's going to take you a little bit longer to take temperatures and make sure that people have their masks. And so there's one of two things we can do. You can either agree to go forward at the price you bid, or we're going to have to go back out and bid under the new circumstances. And I had no idea what was going to happen. And a number of folks said to me, hey, in the suburbs, they're not requiring this. In Grand Rapids, they're not requiring this. And I said, you know, we've lost 1,000 of our neighbors. African Americans are dying of this disease 2 to 3 times more frequently than Caucasians if you get infected. We are going to have a higher standard in the city of Detroit. And an amazing thing happened. All 16 contractors have come back and said to us, we want to keep our workers safe. We'll eat the extra costs. We're going forward. And so we're issuing notices to proceed to all 16 contractors. They'll all be starting in the next week or two, some of them as early as Monday. And there will be 300, 400, 500 more people in the city working in the highest standards of safety on construction site. In addition to that, we're bringing back 200 city employees from DPW to do road resurfacing. So if you've been running over potholes, the crews will be out from DPW next week. I didn't know 48 hours ago what people were going to say. It wouldn't have surprised me in the least if half of the folks said, hey, this isn't what I signed up for. You need to rebid this. Every single company stepped forward and said, we're doing this for our workers on our site. Half of them offered to come here today, but we have with us a great contractor, Curlin Blaze, who's got a major contract to repair water sewer lines in the city, replace the lead lines going to the houses. And I just want him to talk about his reaction and the contractor. So, Curlin?
Thank you, Mayor. Before I start, I'd like to say thank you so much for your leadership. You're well ahead of the curve. We thank you as contractors. You know, you are passionate about Detroit, the residents, and local businesses here, and I thank you for that. We, fortunately, and we're blessed to pick up a $8.2 million project with the city, and before this coronavirus hit, we were ready to rock and roll. But unfortunately, the job had to get suspended. So with this new program that the mayor and his staff rolled out for us, we are so happy to come back and to have a safe working environment for our workers. And we're ready to rock and roll, Mayor. Thank you so much for your leadership and your staff. And thank you again, Gary Brown, as well.
So over the next 2 weeks, Detroiters will see road crews out, landscaping, grass cutting crews out, water and sewer repair crews out. You'll see the city doing the work we're required to do for the FCA plant to pave the way for that to reopen. And I want you to know when you see those workers, there's no place in the country that's got a tougher safety standard. And Dr. Fauci has indicated this fall he's expecting this to spike back up. We are going to prepare all the way through because we know in the city of Detroit what the consequence is of not preparing. Iceware Vezo came to join us, who has also been leading an effort for us that got interrupted by COVID-19. And that's something that's critical to all of our futures, and that's the census. We have $675 billion, 132 programs allocated in this country based on population. And it's very simple. Whoever fills out the most forms for the next 10 years gets the greater share of voting representation in Lansing and Washington and gets a greater share of the money. It's a greater share of the money for our schools, for the hot lunches, for health care and Medicaid. You go right down the list. And today, I'm going to make a direct appeal to Detroiters. You're sitting at home. You got time to watch me every day. I bet you never thought you'd be doing that. You definitely have 10 minutes to fill out the census. And so, as you know I like to do, I've done a little PowerPoint. And we'll see if the technical side of this works a little better than we started. So, the interesting thing about the Census Bureau is they actually give you a report card. They continually tell you what percentage of your residents have filled out the form and sent them in. And we have 17 cities that are mid to large cities in the United States. And every week, we track where does Detroit stand on the returns. And where we stand is not good. Of the 17 cities now, we sit in 13th place. We're ahead of Buffalo and Cleveland and Miami and Newark. So I guess that's somewhat better. 10 years ago, we were dead last. But this is not where we want to be. When Minneapolis can get 62% of the people to send in their forms, when Milwaukee can get 51%, and we're sitting here at 42%. We are giving away the money we need for our residents' health care, for their food, for all kinds of support for 10 years. We lost a huge amount of money in the last decade because we didn't fill out the forms. We have this number now updated on our website every week. We are sitting in 13th place. And if we stay there, our residents are going to suffer for quite a long time. So here's what we've done. We actually have done this by neighborhood. I don't know if you can see this, but I'll tell you what it says. In District 1, there's quite a difference. North Rosedale, 68% of the people have filled it out. In O'Hare Park, 58%. Crary St. Mary's, 56%. Grandmont, 56%. 7 Mile and Rouge area, not so much, 45%. Hubble and Linden, 40%. And in Brightmoor, 33%. We really need the leadership in these neighborhoods to step up and talk to your neighbors, because when it comes to the census, the trusted voice is who you listen to, and a lot of times a trusted voice is not government. In District 2, same thing. Sherwood Forest, Palmer Woods at 73%, University District 66%. In the middle, we have Bagley, about 56%, Fitzgerald Marygrove, 39%, down to places like Dexter and Fenkell in the range of 34%. You can go on the city's website and you can see where your neighborhood stands. But if you're in one of these lower neighborhoods, please reach out to your neighbors. And I got to say, Sherwood Forest and Palmer Woods, why 1 out of 4 people haven't filled out a census? It's nothing to be proud of, even at the upper levels. We need to reach our neighbors. District 3, Mohican Regent, Butler, Sherwood, and Pershing are leading the charge. In the middle, we've got Krantz Woods and Connor Creek. Now near the bottom, Cadillac Heights, Franklin, and Greenfield Park, with only 1 out of 4 people filling out their forms. In District 4 on the east side, East English Village, Moross Morang, Yorkshire Woods, Jefferson Chalmers up at the top. Down near the bottom, Maple Ridge and Riverbend. You can look up on our city website, DetroitMI.gov, see where you stand. District 5, Indian Village, Elmwood Park, Boston Edison up near the top. You got neighborhoods like Arden Park and the North End down toward the bottom, and then the very bottom, Dexter, Linwood, Herman Kiefer, and Poletown East. In District 6 in Southwest, Boynton, Core City, North Corktown, Woodbridge, Mexican Town have done reasonably well. Springwells, Hubbard Farms are in the middle, and down near the bottom, Hubbard, Burchard, Wayne State. And this is a real issue because the students went home. Normally they would be there. when you fill out the form, you fill it out where you would normally be on April 1st. And so if you know of Wayne State students who have gone home but normally would have been on the campus on April 1st, they should go on and fill out the form where they would have been. We need them to count. And finally, District 7, Far West, Aviation Sub, West Outer Drive at the top, Warrendale, Waco in the middle, and down near the bottom, Happy Homes and Narden Park. The other thing we want to talk to people about is if you live in apartments. And everybody here knows that you got people who live in this city who use a suburban address on their driver's license. Everybody understands why. That's okay. When you fill out your census form, it cannot be released to any other agency, the federal government, the public, for 70 years. We'd like you to fill out where you actually sleep, effective April 1st. And so if you're in an apartment in the city of Detroit and your driver's license says something else, you should put down your city of Detroit address, where you actually stay. We may not count you for car insurance, that's not my issue today. But we need you to count for the next 10 years. So please honestly fill out the form where you really lived. Nobody will see it until the year 2080. Okay, so you got your forms in the mail. You didn't fill them out. I did this this morning. Of course, I filled it out the first time, but I went through this process this morning. This is the easiest thing in the world. All you have to do right now is go to my2020census.gov. That's it. You don't have your form, you lost it, you threw it out, doesn't matter. You never got a form, doesn't matter. If you're staying in this city, we need you today to go to my2020census.gov. You click on it, and there's a login page, and the first thing it says is, fill in your census ID. Your census ID came in the mail. If you've got it, that's fine, but if you don't have it, it is no problem, because there is a big link right here that says, if you do not have a census ID, click here. You forgot the paper? It doesn't matter. You click there, and it takes you to an address page. All you have to do is type in your address, and you click again, and it takes you to fill out the form. You will get that form filled out in 10 minutes, and this community will get the money for the next 10 years. And so we're asking you, please, go to this website and get this done. $675 billion in 132 programs. That's what's at stake in this country. And if the Minneapolises of the world fill it out at 62%, and Detroit does it at 42%, the money that should be going to the children in Detroit is going to be going to Minneapolis. It's just the way it works. If we don't help ourselves, nobody else is going to help us. And these are things that we very much need. And so when we started on this process, and I started talking to groups, and the groups, Vicky Gavari and all the groups in the city have been phenomenal. But I was a census taker in 1980 in Ann Arbor when I was an undergrad. I knocked on the doors in racially mixed neighborhoods. I saw with my own eyes that African Americans and Latinos are less likely, when the government asks you to fill out a form, than Caucasians, which is why Detroit's been undercounted, and a lot of minority communities have been undercounted for many years. And I realized from that experience, who people trust are those they know, those who are around them, not necessarily the government. And I was saying this in a group, and I swear Vezzo stepped up. And he said, I think I talk to folks that you don't usually talk to. And I say things in a different way. And he says, and I expect to be here in 10 years. And I want to make sure everybody in my city gets everything they're entitled to. Can I take a leadership role? And it has been remarkable to watch this young man who is not just going to be a leader in music, he is becoming a great leader in this city. So let me turn it over to Vezzo.
Thank you. Right now, from everything that I understand and what I do know about census and what's going on, with census and what's going on with coronavirus, it's one big circle. We need to fill out these forms right now more than ever. If you never understood what census was, or you never had any understanding, just know that this money, we need this money for healthcare workers, for children, for child healthcare insurance programs, for Medicaid. We need this more than ever. I lost people to coronavirus. My wife lost people to coronavirus. And we in the middle of a pandemic that no one could have ever predicted. And I'm not saying that if we had did what was right when it came to filling out census forms 10 years ago, that those people wouldn't have passed or, but we could have had some type of leverage in this thing because we would have had the proper funding that could have went to these healthcare workers, that could have went to these child healthcare insurance programs or anything that we need, and like I'm on Instagram every day, I'm scrolling, I see a lot of people post up the amazing work that the healthcare workers are doing and an amazing job that a lot of the workers in that field is doing, but they posting their pictures up and they saying thank you. If you want to thank those people, do it with your actions. Make their job easier. Help get them resources. We need these resources. It's not about everything that I understood to be about census. All of that went out the window when this happened. We need this more than everything for these children, for this healthcare insurance, for these workers. I can't stress that more important. If it was up to me to feed everybody in this room, and if it was 10 people in this room, and I called and I said, and when I come in the room and I say, I asked my manager, Chanel, how many people in the room we need to feed everybody? And she asked everybody to raise their hand, and out of 10 people, only 2 people raised their hand. When I get there, only 2 people getting fed. So this is up to us. We have this opportunity to like I said, we can't even predict. I can't predict 30 minutes from now. If you can predict 30 minutes from now, show me something, teach me something. We don't know what will happen in 10 years from now. We have to be prepared. It's no other way to be prepared than to take responsibility and fill out these forms so we can have the funding. We have to help the mayor help us. I'm sure if we all can go in our pocket and give money to the workers and to these 132 programs, we will, but we can't afford it. But you guys can afford it. And I mean that I'm talking to myself as well. I can afford it. Why I can afford it is because I can go and fill out my form and I can be a part of us receiving this funding so we can get this help. We need this. We need this. If you lost somebody to the coronavirus, you don't do it for them. At this point, don't even do it for yourself. Do it for the people we lost. We have children dying. We have older people dying. We have people dying out there, and we need this. We don't know what will happen 10 years from now. Let's at least get some kind of curve in that. Let's take responsibility. Let's be of help of the future. My children are 3 and 4. 10 years from now, they'll be 13 and 14. If this was to happen again and we do what's right today, I can actually say I was a part of having a curve and taking something that was supposed to tear us down and we had the funding to stand strong. Right now, we don't have the funding to stand strong. We're not strong. 42% out of Detroit has filled out their forms. That's under half. So technically, we don't even have the proper amount to take care of half our citizens. We need this help. I need this help so we can help each other. That's it. Don't get no realer than that. You know what I mean? It's from the heart. I'm up here because I know what need to be done. I believe in this. I don't promote my music this way. I just put it out. I don't believe in my music the way I believe in this. And that's from the heart. I mean that. Take care of business. Please do it for your family. Do it for your loved ones. Do it for the people who's sick, who in the hospitals. Show them healthcare workers with your actions that you appreciate them. Because talking and posting an Instagram picture or posting a Facebook picture of them dancing and doing TikToks, that's not showing no appreciation. Love and everything, all of that is an action. Love is an action. Appreciation, it's an action. So do it with your actions, Detroit. If you don't have no other reason to take census serious, use this pandemic too, because we couldn't have predicted this. That's all I can say.
Do it with your actions, Detroit. Sounds like it might have the makings of a song. So it seems like we've been hit with one bad thing after another, but sometimes in the middle of the darkest times, a blessing comes. It's totally unexpected, and I swear Vezo has been a blessing for this effort, and this community stepped up in a way that I never could have imagined. The hardest part of this is 3 times a day we get an updated report from the state on deaths in the city, and I look at every single one of them. And as we crossed 1,000 today, it was heartbreaking. But I look at the last 16 people who have died in this city. 14 of them were over the age of 70. 8 of the last 16 were over the age of 80. More and more, it is our elders who are bearing the brunt of this. It's been true to a large extent from the beginning, but as the hospitals and the medicine has gotten more sophisticated, the people who are left most vulnerable are the ones who are always left most vulnerable. And that's why what Denise Fair is doing, having gone through the nursing homes and now going through senior centers, we are acting in a way I don't think anybody else is, and to report on what she's doing and the progress she's making is our health director.
Thank you, Mayor. So on Monday, I announced that all nursing home staff will be required to get tested by May the 11th. And I want to thank those facilities who have already signed up, which is about 15. So we still have 11 more to go. And again, thank you for putting your staff first as a priority. Yesterday, I announced that with the support of not only the health department, but the CDC and Henry Ford, we will now begin testing long-term care facilities. We've identified 37 based upon the number of COVID-19 cases, and we are planning to test all 37 of them by May the 15th. And so we are starting today, and by the end of this week, we would have already visited at least 5 sites. Those tests will be processed at the State Fairgrounds with a quick turnaround of about 2 days. Again, our priority is these congregate settings where COVID-19 spreads really easily. As of today, there are now 8,954 confirmed cases and 1,008 deaths. I regret that so many of our families are experiencing heartbreaking loss as a result of this virus. Now, the number of new cases of COVID-19 is trending downward, and that's thanks to all of you. All of you are heeding the executive order, you're following your guidelines, and I know we can beat this. Now, COVID-19 is still a present danger in our community, and it's transmitted from person to person, which is why it is so important to stay the course. As I swear said, let's do it with our actions. So we, Detroit, we're going to continue to practice social distancing, washing our hands, wearing a mask, and staying at home. Because the reality is we are going to be in this for a long time. And this is our new normal. You may be missing out on your favorite restaurant. You may miss out on getting your hair done and your nails done. And as a woman, I know this is challenging. However, vanity should never come before one's health. So information related to COVID-19 and how we can govern ourselves accordingly is available on our website at detroitmi.gov/health. I encourage you to seek out the latest information because it's just too dangerous to accept the word of mouth from everyone else without checking it out for yourself. As I've stated before, knowledge is power. So let's continue to stay on our game as we continue to slow the spread of COVID-19. And with that, I'll turn it over to the mayor.
Okay, any questions?
Good afternoon. ML Elric with the Detroit Free Press. With the reopening of the construction sites, we've heard from some, I think mainly smaller contractors who are concerned that they're not able to get the PPE they need, the hand sanitizers, the wipes from their normal places like a Lowe's or a Home Depot. What can we do to make sure that everybody who's going to be on those job sites has what they need to do to follow those standards?
So that's a great question. It's a conversation we've been having with the contractors for the last 48 hours. And what we have said to them is this: if you will sign up and take this extra responsibility, we will be there to back you. If you can't get PPE, we've got access to it because we can get it in bulk. We're very good at it at this point. We got a warehouse, huge amounts. We'll sell it to you at cost, $1 or so, whatever it is, a mask, but you won't have to go scramble yourself. If you have a key employee who comes in with symptoms, 2 weeks from now, 4 weeks from now, we will get them immediately over to our 15-minute site, get them tested, so you know right away whether they can return to work or whether we need to check 3 or 4 other people they might have been in contact with. And so we're going to be the partners. And you're right, the smaller you are, the more you have a chance of getting swallowed up in this. By coming in with the city on this partnership, we're going to make sure every one of their employees is promptly tested, and we're going to make sure they have access to PPE.
Okay, and in terms of smaller outfits and maybe the larger ones too, who need to pull permits and things like that, will city workers be available to help them get the paperwork they need done?
And so it's so interesting what you learned as we started to prepare this. And the first thing that happened was the other department said, we got to get our inspectors back. So now we're running the inspectors in for the 15-minute test to make sure they will be ready to go by Monday as this work starts. And over the next 2 weeks, it'll get started up. Different people are in different stages. And so what they've all done is they've given us an order, who's going to start Monday, who's going to start Wednesday, who's going to start a week from Monday, and we're scheduling their employees through our testing sites in the order that they're going to be ramping work back up. So we're going to be hand in glove with these 16 contractors and their subs.
And that's a nitrate glove, right?
Exactly.
Okay. I think the man who put your father on the federal bench said, trust but verify.
Right.
Will the city also be going out to these websites to make sure, or these work sites to make sure people are following the rules that you've laid out to get them back to work?
Right. Our B-Seed inspectors will be doing that for these sites, yes.
Will that require extra inspectors or bringing on additional bodies to cover
It
all
won't
these
require additional bodies because so much has slowed down in this economy. So right now, I don't know whether they're, I think a lot of them are probably on 10% furlough right now because there hasn't been a lot to do. But this is what we're staging. Literally, we're going down the list of how many inspectors do we need to call back for which elements of this. But no, I don't see hiring new, but I think it'll be work for people who haven't had a lot to do the last 6 weeks.
Okay. And in terms of some of the job sites, some of the more high-profile job sites, have you heard what the effect of this pandemic has had on progress at the Michigan Central Depot and some of the more high-profile, the Hudson site, things like that? Will they be affected by this?
They've all been stopped. They won't be affected by this. The governor, I expect, will issue an order relative to starting construction. What the standards today are contracts the city is buying. So if the city contracted for road work, if the city contracted for landscaping, if the city contracted for water and sewer work or construction work, these rules apply to our contracts. I don't have a legal authority to impose them on Michigan Central or the Hudson's building. Those ultimately will be done by the governor, but once the governor sets forth her standards, I will certainly be attempting to convince those folks to follow our standard. And I got to give FCA credit. They've already reached out to us and said, can we use your testing to get our folks through? So you are seeing some corporate leaders that are really caring about their employees and thinking ahead of time and reaching out ahead of time. We're going to ramp up our testing and take care of everybody in this town that's going back to work that wants a test. We're going to ramp up and test them.
Okay. And in terms of some of these privately financed projects, are you aware of any projects that are now in danger or have been canceled because of a problem getting workers, hitting deadlines, maybe financing has disappeared because of this financial as well as health crisis?
You know, we've heard a couple of the condo projects, but they had trouble getting financed even before this. So I have not heard of anything that's specifically in the last 6 weeks, but I guess we'll see. What I'm hearing is just the opposite. People are really anxious to go on their construction projects.
Okay. And in terms of the city contractors, a week or two ago we talked about possibly going to some of the city contracts and asking them to reduce their charges to the city in the same way the city workers have had to give back to try and make the balance, bring some balance to the budget. How's progress there, and will that affect these contractors?
These folks, and I'll let Mr. Blaze talk about this, these folks essentially have taken a cut by taking on the added expense. I don't expect to go back to them for any more. As far as where we are overall, maybe we'll get Boise Jackson to answer that question. He and Dave Masseron are engaged in that right now. And I don't happen to have an update. But, Curlin, you want to talk about what this means to you as a contractor to have new requirements after? When did you put your bid in on our work?
We put our bid in last year.
Okay, and so you got the bid award last year, and we let you know in the last 24 hours we got. But talk about what that means to you.
So now I don't want to speak for any, other contractors, but for us, we were ready to rock and roll. You know, a great opportunity for the city. We hire a lot of city residents, and for us not to get this job, they had to particularly stay at home. You know, that really hurt. So we took the time for, during this process, 4 weeks out, that we devised a plan to have most of these PPE in-house for us. We're talking about gloves. As a matter of fact, we started a work sanitization bucket for us for each job site. So where each person go on the job, make sure they wash their hands, make sure they have the proper PPE and also gloves and masks on that project. So again, the project to us, you know, definitely meant a lot to us, but to have it suspended and now to reopen, we're happy. And we had to take some cuts. We had to. It was the commitment from the mayor to us to say, hey, would you still like to have this project? But here's some cuts. And we took them. Because we had workers, City of Detroit workers that were still, you know, there to work.
In terms of cuts, do you mean in the overall size of the contract or your costs up front?
My costs up front, part of it, contract as well, but mostly our costs up front.
So we aren't cutting people's contract price, but
Okay.
we are. I can just tell you what's happening already on our job sites is when somebody checks in and has to stand 6 feet apart in a line to have their temperature checked and be asked 6 questions on symptoms, you lose 15, 30 minutes
Absolutely.
to the start of the day. You're paying for that. So when he says
Absolutely.
a cut, basically you've got contractors, depending on how big or small your job site is, you're going to have to pay those workers to stand in line and answer those questions before they get to work. And that's why I say all 60 of these contractors are bearing an expense for the overall good of the community.
Mr. Blaze, is there a point where if the city were to ask you to take 5, 10, 20% off the contract where you'd have to say, well, it's better for us not to have the job because the margins are just too thin?
Absolutely.
But I mean,
I'm
is
just
there
a
is there
businessman.
sort of magic number out there that you?
I can't talk about that right now, but absolutely, I can't take those deeper cuts. But in regards to that, you know, that's something we have to talk about with the mayor.
Okay, and Ms. Fair, in terms of the homes that you've now added to the city's very ambitious program to test, what are the size of those long-term homes? Are we talking 5 or 6 residents, or are these dozens, hundreds? Are they all over the map?
Yeah, so they're all over the city of Detroit. We have identified 130 long-term care facilities. We're going to start with 37, and these are long-term care facilities that already have identified COVID-19 cases, but they have a lot of residents. They have, I don't have the average. I can get those numbers for you, but this is our priority. We're going to be aggressive, and we're going to hit our target by May 15th.
But they're substantial facilities.
So we're not talking about a group home in a neighborhood that may have 3 or 4 people who, for whatever reason, need around-the-clock care.
There may be some of those, but that's not.
Yeah, no, go please. Yeah, so we are, again, for those 37, there are some smaller homes, but again, those are part of our 37. So some of them do have 5 or 6, but we need to start with them now because again, if you have one case that's identified, because it's a congregate setting, COVID-19 is going to spread really quickly. So we do have some smaller homes.
Okay, and
We can get you a number tomorrow on how many residents we estimate are in those 37 homes.
okay, and Ice, where can people find your music? And if they're new to what you do, what do you recommend they look for first?
You go on my Instagram, iceware_Vezo. I'm on YouTube, Apple Music, iTunes, everywhere. iceware_Vezo.
What's your best tune? What should we start with?
Maybe Money Phone. That's a good song.
Money Phone?
Yeah, it's the most popular, I believe.
You're reaching out to a whole new audience here.
Yeah.
Okay, thank you very much.
Thank you.
Hi, we just have a few questions from reporters who are not here today. Two from Cranes regarding the testing at the long-term care facilities and others. For Ms. Fair, you may have mentioned this, but has testing started at these other facilities yet?
We started this morning. So we're going to hit a couple today, and then by the end of this week, we would have gone to at least 5 facilities.
Okay, and are there any specific direction or actions that the health department has taken that have come from the recommendations of the CDC staff that are here?
Sure, they're helping us identify our entire strategy. And so they have guided us which facilities we should start with, and they've been really helpful. They'll be here for another week or so.
Okay. And Mayor, from Christine McDonald at the Detroit News, this goes in a little bit of a different direction, but in light of the financial impact of COVID-19, is the city still looking at ways to help Detroiters who may have been affected by overassessments in past years?
Yeah, I think as we have before, but I've said this many times, is if there are preferences that we can give for different programs, we're looking to do that. We've obviously been distracted by something that's taken 1,000 of our neighbors, but our feeling on that hasn't changed.
Okay. And last question from Bankley Thompson wants to know if you support the governor's plans to ease the stay-at-home restrictions, and are you in communication with the governor?
Yeah, the answer is yeah. We're in communication with the governor's staff every day, and I think the governor's done an excellent job.
Okay. That's the last question.
All right. Thank you.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用呢？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗、更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。